Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida, here with native Raleigh in North Carolina, Sherry. And one of the reasons why I wanted to interview Sherry was she has a little bit of an unusual condition called Tensor Tympani Myoclonus that's improved a lot with curve correction and prolotherapy. I also like to interview folks sometimes when they're in the middle of their care. So we're going to go through all the different symptoms that you have or had, and some of them you still have. So I think that's going to show people why it's a lot of visits sometimes with prolotherapy because of the extensiveness of the negative changes in your curve when you first got here. I mean, you had a really big reversal of the curve, and then you had instability. But why don't you talk about, you know, I think your condition started something like 2018 or something, and we're now 2024. So that's it's been six kind of torturesome years.
It was. So the tinnitus started in November 2018, and that was really, well, I'm not really sure what caused it, from talking too loud, yelling too loud. But then I had a head injury in January of 2019. I hit my head on my fireplace mantle.
Okay.
Which I now know when you hit your head from you that, you know, it does something to your neck.
Yeah, because you always go like that.
Yeah.
You hit your head, then you twist your head.
And then after that, I started having all kinds of symptoms, but I didn't remember hitting my head.
Okay.
So I never went to a doctor and said, hey, I hit my head and I'm having all these things. So I just started having tons of symptoms.
Yeah,
hyperacusis.
Okay, hyperacusis.
Autophony.
Why don't you talk, because, you know, some people don't know that term. So when you say the term, explain what symptom you have.
Yeah, so hyperacusis is when everything is very, very loud.
Loud sensitivity.
Oh, can't even go into a store. I couldn't put a fork on a table, or on a plate.
Or noise sensitivity.
Yes, very sensitive to sound.
Was it also your own voice?
My own voice.
Can sound too loud.
Very loud.
Okay.
And that's autophony. So autophony is when my voice is very loud to me. So if I'm talking to somebody, sometimes I'm way too low and they can't hear me. But to me, it's really, really loud. So that started. Chewing food was almost impossible. The first time I bit a cucumber or a potato chip, I went, oh my gosh, what has happened? What is happening? What is happening to me? My eyelashes, putting mascara on, I could hear it. Every time I touched my eyelid, I went, what is happening to my head? And I didn't remember hitting it, so I didn't know what was happening. My balance just got really, really bad. Headaches, occipital neuralgia, which I learned that term from watching your videos, from the base of my skull all the way around to the front of my head. Horrible, debilitating headaches. It was just, my heart was racing. My heart started racing all the time. I'd have to lay down and just stay there for a couple of hours to stop it. You didn't really know where all of these symptoms were coming from. And it took probably 8 months before a doctor finally did a scan on my brain and said I had a subdural hematoma. He said, you've hit your head. And I said, no, I have not. He said, you have hit your head. I said, no, I've not. And my family reminded me, they happened to be at my house the day I hit my head. They said, Sherry, you hit your head on the fireplace. You don't remember? I said, no. But then it started coming back. So that's where it all came from.
Because it was chronic, they didn't drain it, right?
No.
They didn't drain it. Whereas
oh, you mean the subdural hematoma? Yeah, by the time they found it, it was already looking like it was going to reabsorb.
Okay.
And so the surgeon said, let's just give it 6 months and recheck. And we did recheck in 6 months. And so I never had to have the surgery to evacuate it. But I'm not sure how severe it ever was. We don't know how much pressure it was putting on my brain.
Okay. So between the time that you found the subdural till the time that you saw me, were your symptoms getting worse or your symptoms were getting better?
Oh, worse.
Okay. Because it's an interesting case in the sense that your subdural was getting better, but it really wasn't the subdural that was causing all the symptoms. It probably was when you hit your head, you twisted your neck, and then you got upper cervical instability.
Right. The symptoms were getting worse for 4 years, 4 years, because we're about 5 years out now.
Okay.
To the point that I could not go outside my house. I could not go to a store. I could not drive in a car without a lot of pain. I wear earplugs. I don't have those earplugs all the time. I had to stop going to church, which ripped out my soul. I couldn't go around people, couldn't be around people, couldn't go to restaurants, couldn't clean my house. That was my thing I wanted to do when I came here. And y'all said, what do you want to do? What's your goal? I said, just to be able to clean my house. Just clean my house.
Your real joy, though, you told me, was singing. So that really, because you couldn't sing because you had sound sensitivity, very bad sound sensitivity.
And nerve pain in that ear.
Okay.
When I would sing or even talk too much.
Okay.
And the Tensor Tympani, that was diagnosed.
So explain what Tensor Tympani Myoclonus is.
So Tensor Tympani Myoclonus is a muscle spasm, and it was only in my right ear. And I don't know, it just spontaneously started. It's extremely loud. It was worse than the hyperacusis.
Do you feel the click, click? Do you hear
no click, just thump like a drum.
Thump,
boom,
yeah, thump,
boom,
thump,
boom,
thump.
Boom,
like it's all
boom.
the time. Thump, thump, thump.
Yeah, it could last.
It drives you nuts.
It drives me nuts. So when it first started, I went back to my ENT, told him this new symptom has started, and I literally said, cut my ear off. It's so bad. You can't function through it. You can't do anything. Just lay down and thump, thump. They call it timpani because there's a drum. You know what a timpani drum is?
Yeah.
And it's a thumping that goes on and on and on
just
and
in
on
your
for
right
months.
ear. Then so it went on for months.
I could at times. It was different amounts of time, but yeah.
When you lay down, would it be a little bit better? Or
no.
Okay.
No,
okay.
There's nothing you could do. No muscle relaxants. No nothing to take for it. You just wait it out, and the longest time I think it lasted was 4 months.
Wow.
4 continuous
Even though you
months.
took medications and everything, it just didn't help.
Flexeril, they give you muscle relaxers.
Really help.
No, nothing would help.
Did it affect your sleep?
Oh yeah, I'd have to take something to sleep for the tinnitus.
So you were almost completely incapacitated, basically.
Yeah, after I hit my head, gradually it got worse and worse and worse. And then, I'd seen the videos.
What made you come here? Like, why did you decide to come here?
Well, I'd watched all the videos. Number one, it was so educational, and I like to learn. I needed to learn because I was having such odd symptoms. The doctors couldn't put it together. I'd seen many different doctors. I've done like everybody else. All the neurologists, neurotologists, ENTs. They couldn't put it all together. So the educational videos, but then there was one specific one that I saw from you about your faith. And you shared all of that, and it touched me so deeply. And I had been praying for God, where do I go? Where do I go next? I have to go somewhere. I have to find help. I don't know where to go. And I saw this one video that you did about joy in times of suffering. And I cried and cried all the way through it.
Thank you for watching.
And I said, that's it.
God is good.
God's, sending me there. So that's how I got the courage to make my first appointment, because I didn't think I was sick enough for here, because I know you guys see the worst of the worst patients, the sickest. I
know, but somebody who's incapacitated for 4 or 5 years, it's pretty bad.
It was bad. It was really bad, but I didn't,
Did you have light sensitivity too?
I never have had light.
Okay, and then your stomach, digestive tract?
It's always messed up.
Okay.
Oh, yeah.
Any internal trembling?
Oh, yes. Okay. Oh yeah, I had the internal tremors.
Why don't you explain that, because that's kind of another unusual symptom that people have.
Well, it's internal shaking, and if I would sit and feel it on the inside, the vibrations happening, and hold my hands up, and I can't see it. You can't see it. It's just internal.
I've had that, believe it or not, I've had that on a few occasions.
Really?
Well, that's one of the things, like when people come here, I'm not just somebody who knows the neurology of it. I've had a lot of the different things, because you know how your X-rays and MRI, it shows a lot of degenerative arthritis. It's not just instability, there's degenerative arthritis. Well, that's what my scan showed too, because I was in a really bad car accident when I was a teenager, like 14 or 15. So, so in other words, the amount of space that you have for your spinal cord of the nerves is narrowed compared to somebody younger, because the way your arthritis is. Yeah. Because you overgrew a lot of bone.
Yeah.
But why don't you, now you have had 6 prolotherapy visits.
Yes.
When we started, how many visits did I say
Oh, I think it was like 6 to 10 on the paperwork. It was like there's going to be.
Okay, so why don't you explain the things that are better and the things that aren't better? Like the tensor tympani is a lot better.
Yeah, the tensor tympani. I have not had a real bad episode of tensor tympani except once when I had COVID, and I think I slept on my right side, but other than that, I've really not had it. Now, I don't do the triggers. I wasn't singing anymore. I try not to talk too much because that would trigger it, but I've not had it. I mean, so I've had a long time without it.
So for like 6 months since you started coming here, the tensor tympani is gone, or it's way better?
It's way better. And then the occipital neuralgia, I haven't had that since my first treatment. I have not had that.
And so the head zinging pains, that went away, then the tensor tympani went away.
Yeah, the balance has gotten better. I think today I wrote down maybe at least 65% better my balance. I can move faster in the kitchen because I like to cook. So, but trying to clean my house, I'd have to go really slow so my eyes would track with my body. I had to do everything very quietly, like I have a sleeping baby in the room. And I have to move really slow.
You're saying your grandchild?
No, I'm saying as if I had I had to do everything very quiet and very slowly. And now
just
I
so
can
you
go in the
fall
kitchen.
over or whatever.
So it wouldn't fall over, and so it wouldn't make too much noise that would affect the tinnitus. And now I'm able to boom, just like open cabinets and put stuff in drawers and move around. And, I'm able to bend over and pick something up. My head would feel like a bowling ball. I could not bend over when I came here. I just couldn't pick a sock up off the floor. I would look at it and go, I just can't bring myself to pick it over.
What symptom would you have if you did that?
My head would feel, the pressure in my head was so bad.
So you can bend down now, you don't get that pressure.
Yeah, I don't have that pressure. I can bend down, I can pull weeds out of the garden.
Are you driving?
I was always driving. Driving didn't bother me because I'm looking straight ahead, and I can turn right and left, but now I can turn right and left way easier. I can see a big difference in even though the curve is not where it needs to be, my neck is it's not all loosey-goosey like you had said before. It gets all loosey-goosey with the instability. That's why I love the prolotherapy, because it feels like a natural neck brace. It just actually feels better. Maybe some people don't like the shots, I don't know. But for me, I wanted them. You told me one time I could start coming like every 9 weeks, and I said, no, I'm coming every 6 weeks because I like it.
You're getting better. You're getting better.
I'm feeling better.
You said one of the things that you're really grateful for is you can sing now, right?
Yes.
Okay.
Yeah, but I'm not going to sing. But
no, that's fine. Do you go to church, or are you not able?
I'm not able. I could go possibly for the sermon, but I'd have to sit outside the sanctuary.
So explain, some of the symptoms aren't better yet, because your jugular veins aren't totally open yet. So we talked about that this morning. So explain some of the symptoms you still have. So what are the
really
symptoms?
the only bad symptoms I still have are the tinnitus and the hyperacusis and the autophony. It's all the hearing related things. The balance is much better. The headaches are completely gone.
So your quality of life is
my quality of life is much better. I'm with friends. I'm able to go and sit with people. I've been to a restaurant a few times, wearing earplugs, but still I was able to do it. And just being able to do little things like that, it gives you so much hope.
Oh, for sure.
I am getting better. I'm definitely getting better.
Can you walk around your neighborhood?
Yeah. Okay. I could walk around. I still have to wear earplugs. I keep reaching right here because I usually wear earplugs. But I still have to wear earplugs. But I can walk. I actually bought a rebounder. I didn't tell you that.
Yeah, and then you can put on makeup. Obviously, you put on makeup
today.
Oh,
yeah.
So some of the autophony and different things is better.
Yeah, well, you get used to it too. The chewing, eating food, being really loud.
Okay.
That was affected by my neck curve when I started doing the neck exercises. Okay. I put the Denerol up on C1, C2, and it got worse. So I knew I've hit something. Even if it got worse, it was inflammation. Okay. So I put the Denerol. The Denerol is a little spongy thing that you lay on to help your neck curve. So I knew that something in my neck was affecting the autophony. It proved to me that there's something in my neck is affecting the autophony.
That was a good point.
And I So as long as it's a clue, even if you take us one, 2 steps forward, sometimes 1 step back, it's okay because I'm learning what's going on inside my neck, what's going on inside my head or my body that's causing all of these symptoms. So it's not a perfect trip. It's not, 1 or 2 visits and everything goes great, but it's a little bit better, and then you learn something, and then you try something a little different, and then you learn something else.
Yeah. Are you using prism glasses or no?
I do have prism glasses.
Okay,
I don't
so
have
that's
any
good.
on today.
So you are being careful to try to
yeah.
not look down and try to look up.
Yeah, oh yes, all that. It's so much better.
Okay.
I mean, I got all my computers up like you've said,
Good.
and I hold my cell phone up like this. And the good thing is that I can actually make that motion. I couldn't bend.
Okay.
I could not tilt my head back. I could not look up at the ceiling when I
Okay.
first came here. So I can move my neck all the way forward, all the way back, all the way down to the floor. I don't have the clicking and popping. I hear little Rice Krispies in my skull a little bit, but I don't have any clicking, popping, grinding, as you're always saying. When I move my neck, before it was like,
Yeah.
it was pretty bad.
Oh, that's great.
And all of that's gotten a lot better.
One of the things I try to do is when you first come, I think you and I talked about, it's a year.
Yeah, yeah.
It's a year, and then it really is non-surgical neck reconstruction, reconstructive therapy, like you're reconstructing your neck.
Yeah, yeah.
And you still got a ways to go. You still got a ways to go as far as
the X-ray doesn't
what
look
it is
good.
is when you just have ligament laxity and you're trying to change the curve, it's easy. When you got degenerative arthritis and there's parts of, like the lower part of your neck is very stiff, if you will, and then in other words, you had basically a degenerative fusion.
Oh, wow.
And then the upper part is loose, and you're trying to reconstruct so you get a curve with this very stiff part and the loose part. It just takes longer, but you're heading there. And we had talked about your optic nerve sheath diameters now are normal, meaning that your brain pressure's less.
Oh, it's so much. I would have to lay down before I came here for a long time, for a few years. I had to lay down. And I work from home at a computer. I was I don't even have to drive to work, but I would work 4 hours, 5 hours maybe, and my head felt so full and heavy and hurting. I'd have to lay down on the couch flat for about 2 hours and I put on my application when I applied here to drain my ears. I didn't know how else to describe it. I have to drain my ears, which I now know laying on my left side because my left jugular vein is bigger, that I lay on my left side, but I don't have to do that anymore. I never have to stop during the middle of my day and lay down for 2 hours with horrible head pain. I go straight through the day. I don't have to do that anymore.
So it's easier for you to do your job, obviously.
It's easier for me to do everything.
Okay, that's good.
Yeah. And singing. When I got the ability to sing and I don't push real hard, with my air, I don't push real hard because of the Tensor Tympani, but I am able to do it. Before I couldn't hum. I could not even hum one little song and sing really soft without it spasming, and now I can do that. And I am really happy just about that part.
Sure,
I'm happy to clean my house again too, but
Well, that's weird. But you came here wanting to have the have the ability to clean your house.
Yeah, wanting to be able to clean I could have just paid somebody.
I'm an artist. Artists are sloppy.
Okay.
We're messy. But
so am I.
But thank you for sharing your story, and I hope others who have Tensor Tympani Myoclonus and some of the symptoms that you've had, that they'll be encouraged. The internal tremors, those are a lot better too.
It's all that's really
pretty much
gone. But the Tensor Tympani particularly, I would like to say something about that, because the only option my surgeon gave me, my ENT, was to cut that muscle. And it's a very important muscle.
Yeah.
And it's crucial to your hearing. It's crucial to preventing hyperacusis. You have to research what that does. All the research I did on Tensor Tympani Myoclonus was just so negative, so bad, that it was not curable. That the only thing to do was cut the muscle, and then now you open yourself up for the rest of your life. You're going to be sensitive to sound. So I didn't want to do that. I said, there's got to be a cure. There's got to be a cure. And so we're doing it. I mean, it's happening. It's getting better. And no cutting that muscle. It's there for a reason. God put it there for a reason, and I'm keeping it.
Awesome. Thanks again for sharing your
Sure.
story.
Sure. Thank you.